Did you know therapy doesn't have to take years? Brief psychotherapies are fast, targeted, and effective at improving mental health, relationships, and dementia care. Let's explore how they work. Unlike traditional long-term therapy, brief psychotherapies focus on specific issues in a short time frame. They are designed to deliver rapid results, helping with stress, anxiety, depression, and even dementia care. Two of the most effective types are cognitive behavioral therapy, or CBT, which helps change negative thought patterns and improve daily coping skills, and interpersonal therapy, or IPT, which focuses on improving relationships, communication, and emotional well-being. These therapies are widely used in mental health and dementia care, but how do they work, and which one is right for you or your loved ones? Let's take a closer look. Cognitive behavioral therapy, or CBT, is one of the most researched and effective therapies for anxiety, depression, and dementia care. So how does CBT work? It identifies negative thought patterns and replaces them with rational, positive alternatives. It also uses practical techniques to manage stress and emotions. Here's an example. A person with dementia might say, "I can't do anything right anymore." Instead of reinforcing that belief, a CBT approach would be, "You remembered my name today, that's progress." CBT is quick, structured, and highly effective in helping both patients and caregivers handle emotions better. How IPT works? It helps people express emotions in a healthy way, it strengthens relationships and social support, and it teaches conflict resolution and communication skills. For example, if someone is struggling with loneliness or relationship issues, IPT provides tools to rebuild connections, set healthy boundaries, and improve emotional well-being. Whether in dementia care, depression, or daily life, strong relationships equal better mental health. Cognitive behavioral therapy and interpersonal therapy are fast, proven therapies that can transform mental health. Next week, I'll dive deeper into cognitive behavioral therapy and dementia care, breaking it down step by step. Subscribe now so you don't miss it. If this video helped you, like, share, and comment. Which therapy do you think would help you the most? Cognitive behavioral therapy or interpersonal therapy? Let's discuss. For more mental health and self-care tips, check out my channel. Thank you for watching.